Welcome to Thrive at Work, a podcast which offers insights and latest employment trends to help employers attract, retain and develop great people with me, Polly Rathbone Ward. With special guests, we're going to be discussing the many and varied aspects of HR, from practical topics to overarching cultural themes. We'll be looking beyond traditional styles of management to bring new and people-centred ideas to forward-thinking organisations that want to shape a new future where people can thrive at work. Hello, today I'm delighted to introduce Anna Harrington as my guest today, and we're going to talk about something that's quite topical that's come out over the last 18 months as a result of the pandemic and the symptoms that people have experienced from COVID, those who've actually fallen ill with COVID. So the topic's going to be around long COVID. So Anna, welcome. I'm going to let you introduce yourself and your business, I think, if that's all right. If you could tell me a little bit about your background and how you've come to do what you do. Yeah, that would be great. Thank you.
Okay, well, first of all, thank you so much, Polly, for inviting me onto your podcast. I'm delighted to be here. So I'm one of these weird people called a specialist community public health nurse. My specialist area is occupational health. I moved into occupational health from clinical intensive care, transplant background after recognizing really the impact of work on clinicians and also how their health was affecting their ability to work. And that in essence is what occupational health is about. I have been in occupational health, so I've been advising businesses for 20 plus years now, and I really just love what I do. I'm very passionate. I believe in what I do. I believe that my advice and guidance is helpful, and certainly that's the feedback that I'm given. Now, my view of occupational health, the perspective that I take is really very, very, very broad. So, of course, it covers ill health, but I also encompass things like organisation well-being and individual lifestyle. So, for instance, organisational well-being, looking at things like the psychological safety perspectives. And I am actually a member of the Society of Occupational Medicine, Equality, Diversity and Inclusion task force group on that. And in terms of lifestyle, looking at things, I've taken a specialist interest actually in looking at things like sleep, because it's been one of the most common things that people tell me about is poor sleep, and having poor sleep is enormously impactful on people's ability to be safe at work, let alone we're moving into looking at performance as well. So I've done an American College of Lifestyle Medicine course on sleep and health, and I'm also a member of the British Society of Lifestyle Medicine. So, I'm very expansive in terms of occupational health. And in fact, that's what gives me also a lot of pleasure and enjoyment from this profession.
Brilliant. And so what do you actually offer to clients in terms of your services?
Yeah, so I set up my business called Wib Limited in November of 2019. I'm what I call a specialist occupational health provider. So the main aspect of my offering is about management referrals at times of employee performance attendance or behavioural issues where there may be a health component, to refer the individual to me, and I'll be able to give both the individual employee advice and guidance and also the employer on how best to resolve the situation or what the prognosis may be. How long are these symptoms and effects on performance, behaviour, attendance likely to continue? It's to assist the individual employer in being able to make robust, defendable and fair decisions, which of course, every employer is needing to do.
And so moving on to sort of the topic in hand, I guess, what are you seeing now that I guess lockdown restrictions at the time of recording are lifted, and so we're sort of 18 months after the start of the pandemic now. So I guess, what are you sort of seeing in terms of the impact of all of that in terms of sort of prolonged symptoms of COVID?
Yeah, absolutely. So long COVID is the term that is commonly used for those prolonged symptoms. So anything more than 12 weeks, symptoms continuing on for, or it's otherwise can sometimes be known clinically as post-COVID syndrome. And it's, again, something that I've taken a specialist interest in, and I'm part of the Society of Occupational Medicine multidisciplinary group on looking at long COVID. We're seeing that the kind of sectors that are more likely to have employees with long COVID are within the education, health and social care sectors. Probably come as no surprise, because those sectors are the ones that were exposed to COVID a lot more and were less likely to be furloughed, were not able to work from home. And sadly, long COVID can exhibit a very wide range of symptoms, both in sort of severity of symptoms. And so some people might just have symptoms that are very mildly experienced, whereas other people are in hospital with severe long COVID symptoms, but also extremely wide ranging, which I think is possibly one of the reasons why even now there remains some doubt about the existence of long COVID. And I'm sorry to say, but this doubt is even coming from the treating clinicians. So your employees going, for instance, to their GP, and they're left feeling that their GP is not believing them. And actually, it's not even just feeling. I've heard actually being told by the GP that long COVID doesn't exist, which actually, quite frankly, to me is bewildering, because there is substantial and robust evidence globally, for instance, from the World Health Organization, about the existence of long COVID. In terms of my clinics and what I'm seeing, I am seeing, that doubt coming through. What I'm also seeing, I'm seeing two situations really. Either employees are not able to get back into the workplace, so their sickness absence is very long term, or I'm seeing that, they've come back into work and they've done a phased return to work and they're back working at full time and everything's looking hunky-dory, and then crash. They suddenly can continue on no more. And that, again, is very typical of long COVID. It's called the boom bust scenario, where somebody gives everything into an activity such as work and finds that then they're suddenly utterly, completely depleted and they can continue no more.
That's interesting. Would a phased return to work not have been considered as part of that return to work to gradually ease them in so that they perhaps don't go full throttle straight away?
Yeah, I'm really pleased you've brought that up, Polly, because actually the phased return to work isn't appropriate in this circumstance. If you're thinking of phased return to work and being of something like, 4 to 6 weeks period of gradually increasing those work demands and work time, and by that 4 to 6 week period, the person would be working back up to their full contractual hours. The reason that it's not that appropriate is about that expectation that they're going to be up and back working and the job's done, 4 to 6 weeks.
Right. So typically have a review period though with a phased return to work. So we do not usually see that happens. Do not see that happens.
Yeah. Reviews, I understand, are really difficult for employers to do for many reasons, not just from the time perspective, but also in line manager skill, confidence, capability in actually doing reviews that are not performance related. It's a much more well-being, empathetic, understanding reviews. And with long COVID, frequent reviews, so if the employee is coming back into the workplace and working up their hours and demands, just as a line manager, bear in mind that at some point the employee may go, I'm at my maximum. I cannot increase these hours or demands anymore. And what I suggest at that point, and in fact, before that, have an occupational health assessment. I'm going to say that, aren't I? But, it's about getting that professional perspective and opinion, of course, in order to make those robust and defendable decisions. But it's okay. So going back where I was, so pausing that return to work and maybe looking at, and this is where HR, that professional HR advice comes in, of having a temporary contractual change of reduction of hours.
Right, that's interesting, because you could argue actually anybody coming back from long-term sick of any kind, not just long COVID. I get your point. That's a really very good point about, you tend to put in a phased return work, tends to be around 4 to 6 weeks. And then, I think the perception then from the employer's side is that everything is you've done your bit and everything should be all good. But I think, in any kind of returning to the workplace, reviews should be happening, or the phased return to work could be altered or changed or made more lengthy. But your point about temporarily reducing hours is that's really interesting as well. Thank you. Great.
Oh,
thank you.
Yeah, thank you.
Do you see that people are struggling with many different symptoms and they don't realize that they've perhaps got long COVID?
Yeah, certainly. I mean, the most common long and disruptive long COVID symptoms are breathlessness, fatigue. And this is fatigue that is very different from tiredness. It's very different from what you've experienced before. It's debilitating fatigue where, it's a real struggle to sort of push through with it. Joint pain and also brain fog. So brain fog is reduced ability to concentrate. Your memory recall is not as sharp as it once was. Your ability to process information, so maybe whilst you're following a conversation, is more difficult. Your ability to decision make is all impaired compared to your normal before you had acute COVID. And I'm glad you've kind of raised this question as well, because it steps into, well, how do you diagnose long COVID? There is no blood test. There is no scanning that conclusively says long COVID. This is about the clinicians taking a history of when the person had acute COVID and looking at current symptoms, determining whether current symptoms could be caused by some other diagnosis. If not, and the person is describing about having acute COVID, then the default will be to say, all right, this is likely to be long COVID.
Okay, thank you. Great. So from an employer's perspective, are there any particular signs that they should be aware of or should be looking out for with people at work who might be suffering?
Yeah, spot on, Polly. Another brilliant question. I'm so glad you've asked it, because there are what we as clinicians call red flag symptoms. Those red flag symptoms are symptoms that need to be clinically investigated further because they connect with more very serious potential medical diagnoses. So those red flag symptoms are the individual describing that they've got an increase of heart rate. They might say something like a racing heart. They might describe it as palpitations. If they're experiencing chest pain, are they experiencing a new onset of confusion? Are they finding that they're not getting any better at all? Is the breathlessness also not getting any better. If they have any of those red flag symptoms, then as an employer, do not ask them to do anything that is physically exerting until they have been medically investigated. And again, this is probably where you're going to need to turn to an occupational health professional who will explore whether they actually have been fully medically investigated, because I'm having cases where, the individual has those symptoms. They go to, or they try and get a GP appointment, and they're just getting a telephone-based appointment. The national guidelines on this is that the individual will need to have a face-to-face GP appointment. So, very least, things like their chest can be listened to. They can have chest x-rays, but actually it's likely that they're going to need chest scans because they show up different things to x-rays. So any of those red flags, don't ask your employers to do anything physically exerting. It is subjective. What is physically exerting? We all have different abilities, different strengths, different fitness levels. So what is physically exerting to me is going to be different from physically exerting to another person. So asking the individual is so important.
Yeah, really important. Yeah, the great thing about I think from my career in HR and the relationship I've had with occupational health people is that, and the really useful thing is to get that view from someone else who understands the role, but also understands the medical condition of that person and the prognosis and what's happening with them. To give a really useful and insightful view as to what they can and can't do sort of now, perhaps in 3 months' time, and then perhaps in 6 months' time, that can really inform the employer to then plan a sort of practical, realistic and hopefully going to be successful return to work, or to keep that person in work, or sadly sometimes it's actually they won't be fit, they can't be fit because things happened, and they actually cannot continue with their role. So that's sadly I've witnessed as well. But I just think that role and that link between the employer and the occupational health practitioner is just really key. It's so helpful.
Yeah.
Please, what's your view about adjustments, Anna? Please tell me more about that.
So in terms of my referrals, if the employer has asked me to offer some adjustments, then it's something that I take great passion and care with. I'm very clear with the employee in stating that the employer does not have to put in place any adjustments at all, and nor does the employee have to take up any of my adjustments either. And actually, at this early stage, this is just about some ideas and starting off some points of discussion, really. So I tend to look at adjustments within sort of 3 themes. So work location, work demands, and work time. So work location, are they able to work from home on occasions? That would be something that I would be considering. It's not always suitable. Sometimes the employee will say to me, actually, I don't have a suitable place at home, or my home environment. I really just don't like working at home. And that's fine. Of course it is. But also in terms of work location, if they're needing to be at work, then can you actually allow them to be in a location that is quieter? Because environmental noise and a busy place is more energy consuming and draining. So even if it's just for periods of the day, having the person or offering to the person a quieter place to work may very well be helpful for them. In addition to that work location, considering the commute to work, how energy demanding is that commute to work? If somebody is, for instance, sat on a reasonably quiet motorway, that's going to be less energy demanding than somebody who is getting or walking to a train station, getting on the train, getting off the train, getting on a bus, then walking from the bus to the office, as a typical example. example of differences of commutes to work and how significant they can be. And then looking at those work demands. So work demands is not just about the volume of work that somebody has to do, but it's about the complexity of that work. It's about the time scales of when that work needs to be done. So the pace of work. It's looking at also about whether the individual can have some control over those time scales. Are they able to have an influence on how quickly they have to complete that work? Always appropriate levels of control, giving that to the individual is going to be less stressful for them than if they have, very limited control. Looking at working time. So does the individual do shifts, mornings, late sort of afternoon, evening time, night shifts? Okay. Night shifts and late evening work or very early morning work is going to be challenging to the body, what's called the circadian rhythms. So it's going to be more energy demanding, more likely to provoke symptoms and be symptoms to be difficult to cope with. So see if you can offer a regular start and finish time that avoids that late or early morning times. In addition to time, looking at the breaks that you offer. For instance, do you offer a 1 hour long break? If you do, it might be worth splitting that hour into smaller chunks, because it's likely that the person will need to have periods out of work to do what's called effective rest, where they disconnect from anything. Hopefully they will have learned how to do that by the time they return to work. And so, I'm not necessarily saying giving them additional break time. I'm saying the standard break time that you offer, just see if you can divide that up throughout the day. So hopefully there's some examples about adjustments, and hopefully what you might have picked up from that is that none of those adjustments are going to necessarily cost. They're not going to sort of be an outlay of money. Sure, it's going to be changes in your systems and processes, which I absolutely recognize might bring other issues with it. And of course, when we move on to look at the Equality Act and determining whether the adjustment is reasonable or not, those considerations are relevant, to be applied in this consideration. Yeah.
What point in the conversation between the individual and the employer would those sorts of considerations usually be brought up?
Yeah, the considerations of adjustments, I think, should be brought up very early on, because it's one of the most stressful things that an employee often has in their mind, is that they think that they've got to return to work doing their full job straight away. And that can be a barrier to them even attempting a return to work. So really early on, almost, whilst they're off sick from work, if as an employer you feel able to sort of say to them, look, when you're ready to start considering return back into work, please let's have a conversation about, work changes that you think are going to be helpful, and start at that stage discussing about the appropriateness of an occupational health referral.
Yeah, I mean, even a phased return to work is actually an adjustment, isn't it?
It certainly is.
If we just go back a step, the term reasonable adjustment.
Yeah.
If you could, do you have any views on sort of how you would actually define that? Because that is very difficult. It can be very difficult for an employer to, I think there can be a bit of a perception around, oh my gosh, we're going to have to start widening doorways and make all sorts of massive change, which would be costly. And I think there's a bit of a perception there. But do you have a definition of actually what is a reasonable adjustment?
Yeah, well, it's of course a legal definition within the Equality Act 2010, and then of course it would be informed by the case law on that as well. But what needs to be considered, or what is considered actually by tribunals, I'm of course not a law expert at all, I'm a health professional. is the size of your business, your turnover of business. So, a larger business is going to be considered to have more capacity to be able to make more substantial adjustments. For instance, that outlay of funds to, for instance, make physical changes than a smaller employer. It's also very essential to consider, are there any impacts onto safety from making adjustments for one individual? How does that impact on the safety of others? It's also necessary to consider as to whether the adjustments for that individual then place over, too much demands onto your other employees. It's not reasonable to then expect your other employees to be working excessively to pick up the sort of deficits that the other employee isn't able to do. But I think it's really important to bring it in at this stage about access to work. Access to work, a government agency that are there to help fund any adjustments in the workplace for an employee who could be considered to be disabled. So, if you are worried about that financial aspect, then go on to the access to work. It's dead easy to Google it and find it and have a look at, making that application.
Yeah, that is a really good point. Really good point that is there, and for employers to use. Brilliant.
Yeah.
Thank you. So going back to sort of long COVID in particular then, so what sort of practical steps are you advising clients to take, or that you see organisations taking in terms of long COVID and perhaps supporting employees who are suffering, or indeed those employees who are supporting people at home that might be suffering? If you could talk.
Of course. If you've got an employee who's off sick from work, I mean, this doesn't just apply to long COVID. It's any reason for being off sick from work. It's incredibly lonely and isolating being off sick from work. So as an employer, do try to keep in regular contact with them. Now, I know this can bring up other issues as well, and you do have to be very careful in the way that you approach the individual employee. Ideally, you've already got this set out, for instance, in your attendance policy. So the employee knows that if they go off long-term sick, that the employer is going to be getting into contact with them, but it's from an empathetic, supportive and understanding perspective. Try really hard not to put that pressure on the employee about, well, when are you coming back to work? We need you at work. When do you think you're coming back? Although you do, of course, as an employer, need to have some idea of timescales, because of course you need to plan the work. So I absolutely understand it's a very difficult one to do, but it's essential to try and do that. When the employee is indicating that they are feeling ready to come back into work, of course, I'm going to advise have an occupational health assessment. The reason for that is because there are many drivers that could be pushing that employee back into work and pushing them back too soon. So the occupational health professional will make that judgment as to whether actually it is appropriate time to return back or not. I have sort of said to employees, actually, realistically, you're not able to do normal day-to-day tasks. You tell me that you're struggling with that. So, I'll question them. Why do they think it's relevant and appropriate to then start to include work into their, expectations and tasks that they do each day? And it has then made them go, yeah, I see where you're coming from. But sometimes finances are the reason that are pushing them back into the workplace. If, this is great, right, let's bring you back into the workplace. Take a step back. Don't then bring them back in the next day. Take some time to actually plan it. And what I advise is that the individual employee writes out what does their work contain and which of those aspects of work do they perceive are going to be quite demanding for them, or which they perceive might provoke some of the long COVID symptoms. And again, that's where occupational health can be really, really valuable, working with them through that. When they've done that, sharing that obviously with their line manager and working with the line manager to then construct the content of work and that phased return or work trial, bringing them back into the workplace.
Amazing. Thank you.
Okay.
That's great. How much of an issue is long COVID? Do we know how many people are thought to actually have long COVID in this country? Is this something that's being monitored? How much of a problem is it?
Yeah. So another really interesting point. There is difficulties with the data collection because of the diagnostic process, as I've already described. And also that even some GPs are denying the existence of long COVID. It is being revealed that it's tending to be more prevalent in, like I've said, in sectors of health, social care, education. Tends to be more prevalent in the female population. We don't know why that is at the moment. People who have got a pre-existing diagnosis of asthma. It's now being revealed that, people who are hospitalized with acute COVID are more likely to experience long COVID as well. And people who are obese are also more likely to experience long COVID.
Okay, interesting. So I think you said earlier that if someone has had continuing symptoms for 12 weeks, then it is sort of classed as long COVID.
Yes.
And this may seem a bit of a silly question, but is there have people recovered from long COVID? Do you know how long it might tend to last, or is that
not a silly question? No. Highly relevant, and especially when you're looking at that classification of disability under the Equality Act, has it lasted or likely to last for 12 months or more? When I say it, I mean substantial impairments on day-to-day living. So yes, so people are experiencing symptoms for 12 months or more. We cannot define at the moment who is likely to experience symptoms for 12 months or more. So I'm erring on the side of caution. So if somebody has had symptoms for 12 weeks or more, then I will be saying that it is possible that these symptoms are going to continue on for 12 months or more. Therefore, an employment tribunal might find them being classed as being disabled under the EQA. Of course, hopefully, as data is being gathered, we will be able to have more clearer answers as time goes on.
Yeah, because just to go back on what we were just discussing actually about reasonable adjustments and bringing people back to work, the legal requirement is only if it could be classed as a disability. So if that physical or mental impairment that you were just saying about is likely to or has lasted for 12 months, then the employer has certain obligations.
That's right.
But we would always say, I guess, that before then anyway, it would be best practice to explore those reasonable adjustments. It just wouldn't be a legal requirement. Is that what you would agree with? Or
yeah, absolutely. I mean, I can wear two hats here. I'll put my public health hat on to begin with. There is so much evidence that says that somebody who is unemployed, their health deteriorates. They have lower quality of life and lower health outcomes as well. But from a business perspective, I would advise you to really look at it from the ethical, moral values point of view. What type of employer would you like to seen to be? Do you want to be an employer who's seen as being fair and supportive? Remember that every employee will talk to their friends and family
Mm.
about how they're being treated in the workplace, and those people talk to their friends and families. It does absolutely knock on. Um, but also it's about you looking at your employee and considering about the work that they were able to do for you, the quality and volume of work, and giving them a fair chance really at being able to return back to that. I can honestly say to you that in my 20 years of doing occupational health assessments, it's very rare that I would have an employee saying, I don't care, or indicating to me, I don't care about the type of work and the quality of work that I do. They usually, individuals are incredibly dedicated to their work means so much to them, and if they are kind of in that more negative attitude, then it's as a consequence of something else that they perceive as detrimental having occurred in the workplace.
Interesting. Gosh, great. And yeah, I really find your point that you said before about unemployed people and the quality of life and the impact that that has. Yeah, really important. I think work is so important for so many different reasons, isn't it? I think we've seen that over the last 18 months, all working remotely.
Exactly.
People have really struggled with social isolation and
Mm.
missing the team, the sort of having your team around you. Yes, we can work
Exactly.
together through technology, but not quite the same, is it?
It isn't. It
Yeah,
isn't.
it's helpful for our sort of well-being, isn't it? I think.
Totally. It gives us our sense of purpose, our sense of being valued, our reason for getting up in the morning. It gives us a sense of routine. It gives us a sense of agency and being capable and strong and doing something.
Mm, yeah, that's another interesting point because I think people on furlough
Mm,
as well, because even though they were being looked after by the government,
mm,
no real reason to get up in the morning, or there was no purpose for your day. And yeah, I've spoken to quite a few people, HR people, who were looking after and communicating with employees who were on furlough
mm.
during that time, and they were the group that struggled the most, really, the people on
Yes.
furlough. Really interesting point.
Yes.
Fantastic, Anna. Thank you. You've been so generous with your time.
Oh,
Is there anything else that you just wanted to add in terms of long COVID or what employers should be considering?
I suppose the only other thing I would go deeper into is about those reviews and I'd just like to bring out one point about the content of those reviews, and when you're considering if the individual is able to increase their hours, their work hours and work demands.
Is this reviews in terms of when you've created a report?
No, this is the reviews of when the individual has come back into the workplace and you're checking to see how they're getting on at work, and you're checking to see whether the hours can be increased or not, whether the person feels able to increase their hours or not.
Okay.
One question I suggest you ask of them is, how able are they to complete tasks at home, to do with duties with regards to their family, but also how able are they to do their leisure and social activities? If they're putting all their energy into work and not able to do those activities out of work, it won't be sustained. They will crash and burn at some point.
Interesting. So to ask those questions about what they're doing, what they're able to do at home, and what they're enjoying doing as well.
Yeah, it's going back to that work-life balance.
Mm.
It's so important to have a really good work-life balance. And of course, the individual employee may not answer you. They may be worried for whatever reason, or just want to keep that side private. That's fine, but at least you've given them the opportunity. to talk to you about it.
Yeah, I mean, if you see somebody who's off sick and you see them doing something that I don't know, doing a leisure activity or out and about somewhere, that may give the employer or whoever a purpose to think something else of them. So what would you advise in that respect?
Yeah, lifestyle is extremely important for good health. So what I mean by that is going out and having fun, doing regular exercise, having good social contact. So as an occupational health professionals, we will be recommending people to be actively doing that in all ill health conditions, unless of course they're contagious. To be making sure that they're doing activities that give them sense of fun and pleasure, enjoyment, good and supportive social contact, and trying to do, the physical activity that they feel able to do.
Great, thank you for that.
It's all right.
If anybody wants to get in touch with you, Anna, how can people get in touch with you?
Oh, thank you. So my website is www.whibwhib.co.uk. And my email is Anna, ANNA, @whib.co.uk. I'm also very prolific on LinkedIn. I'm less prolific on Twitter, but you can find me on there as well. And you're very welcome to connect and have a chat with me through any of those social media places.
Brilliant. Thank you so much, Anna. I really appreciate your time. Thank you.
It's an absolute pleasure, Polly. Thank you so much.